We begin with breaking news tonight as the state health department now confirms the first known cases of the Omicron variant of the coronavirus in Ohio. Will Ewick joins us now late with the latest. And Will, what do we know?
Yeah, Lena, there are two cases that were detected in central Ohio, both adult men, and both testing positive for COVID on December 7th. Those cases were then identified as the Omicron variant by scientists at the Ohio State University. Both men had received an initial COVID-19 vaccine dose. However, in both cases, the dose was more than 6 months ago, and neither of them had received a booster shot. The health department says that the two men are experiencing mild symptoms and neither have been hospitalized. Here locally, Dr. Amy Edwards, an infectious disease expert at UH, says these most likely are not the first cases of Omicron in the state, just the first two confirmed, as organizations only test a percentage of positive cases to try to keep an eye on things. There's still a lot of unknowns with Omicron, however. Experts say this variant is highly contagious, much like Delta, but could it replace Delta as the dominant strain in Ohio?
We've been debating it back and forth. There are certainly some people who are looking at the R naught and think that Omicron will become dominant. But I've heard the opposite argument too, that Delta is so contagious and it's so entrenched that Omicron's not going to be able to completely replace it. Honestly, we don't know. They're both really, really contagious, and so it's going to be a bit of a battle between the two viruses. I guess we're going to find out.
Now, scientists are still studying things with Omicron to see how this variant works, but the good news so far, the first surge was in South Africa, and the Ministry of Health there, their research showed more mild symptoms than Delta. However, Lena, Dr. Edwards says there's still a lot of research to be done on that. More on this coming up tonight at 11.
All right, looking forward to that. Thanks, Will. We'll see you at 11.